Okay, hello everyone, and welcome to this short session on meningomyelocele. Right, so today we are going to discuss about the basics of meningomyelocele and how to do a short case examination. Right, so recently there's a tendency to give meningomyelocele for your pediatric short case examination. Right, so it's very important you have a very good idea about meningomyelocele. Right, okay. First, what is meningomyelocele? What is meningomyelocele? Right? So as you can see in this picture, right? Meningomyelocele is a neural tube defect. Neural tube defect where your meninges and the spinal cord and the nerve roots, right? They herniate through the vertebral defect, right? So there's a vertebral defect, and your meninges, spinal cord, and the nerve roots herniate through that, right? So what happens? Then your uh, neural tissue gets exposed to outside, which can lead to infections and inflammation, right? So that is the basic idea about meningomyelocele, right? Now, so why does this happen, right? So this happens due to a congenital neural tube defect. Congenital neural tube defect, right? So there can be multiple risk factors, right? So the commonest risk factor is folate deficiency, right? Inadequate intake of folate during pregnancy is the most common risk factor, right? Then apart from that, maternal diabetes mellitus, sodium valproate, right? Those are the risk factors for this kind of neural tube defects, right? Okay. Now, in which part of the vertebral column you find this defect, right? So it's very common at the lumbosacral region. Right? It can be found anywhere along the vertebral column, but it's very common among the lumbosacral region. Right? And it can even be found in lumbar, thoracic, or even cervical region, which is very rare. Right? Okay. So I think you got a basic idea about meningomyelocele. Right? Now, how to do the short case examination. Right? So in a short case, if you are asked to examine this child, uh, who's coming with the meningomyelocele. How are you going to approach him, right? Okay, so first it's good if you start examining from the back, right? So the first step is to examine from the back. Examination from the back, right? So there, what should you look for, right? So here you can follow the normal sequence, inspection, palpation. There's no percussion or scaldation here. So you can do inspection and palpation first, right? So in inspection, what should you look for, right? So here you should look for the initial site. Where is the defect? Whether it's lumbosacral region, lumbar region, thoracic region, likewise, you have to look at the site first, right? Then get an idea about the size and the shape of the protrusion. Size and the shape of the protrusion, right? Then check whether there's skin covering. Skin covering. Whether it's exposed to outside or whether there's a thin membrane, right? Then most importantly, look whether there's an ongoing CSF leakage, whether there's an ongoing CSF leakage, right? That you should look for. Then any ulcerations or ongoing infection or inflammation. So those are things you should look for in the inspection, right? Then palpation, you can check the temperature, right? Look for tenderness and then consistency, right? So those are the things you should do uh, under inspection and palpation, right? Now then comes the most important part, right? Examination of the nervous system, right? Examination of the nervous system. nervous system. Here, if it's a lumbosacral meningomyelocele, you have to do a thorough, complete lower limb examination. Lower limb examination, right? So lower limb inspection. Inspection, you look for any fasciculations or whether that's muscle wasting, right? Inspection, you look for muscle wasting, fasciculations, or any skin deformities down there, skin deformities. Then check the tone of the lower limbs. The tone is usually decreased, right? Then look for muscle power. Power is also decreased. You get a paraplegia here, paraplegia, right? Then about the reflexes, ankle and knee reflexes, both are reduced or diminished, right? Reflexes. Then looking at the planters. Planters can be extensor, right? Then if it's a slightly older child, you can look for sensation as well, sensory level. So normally what you find is reduced sensation below the level of the lesion, right? Reduced sensation below the level of the lesion, right? Now, along with this lower limb examination, you should also look for the bladder bowel care, right? Bladder bowel involvement, right? Here, right, you have to palpate for the bladder. Check whether there is a palpable bladder, right? Then whether there's dribbling of urine, right? Then perineal sensations, which are lost here, perineal sensation. Then about the anal tone, which is also diminished. Right? Right. So those are the specific examination points you should cover here, right? Then after finishing this, you can offer and do the general examination, right? General examination, right? So in the general examination, what you should look for, right? First of all, you have to offer to check for growth parameters, because these children can be having certain deficiencies in growth, right? Then you have to measure the OFC to look for hydrocephalus, because hydrocephalus can be associated with meningomyelocele, right? Hydrocephalus. Then you have to look for a VP shunt scar, VP shunt scar. So behind your ear, you can look for the VP shunt reservoir, and you can palpate along the sternocleidomastoid, right? Then, most importantly, look for signs of raised ICP. Raised ICP. You can look for any bulging fontanelles, which can be a sign of raised ICP, right? Then, along with that, you have to check for any spinal deformities. This you can look for in the examination of the back as well. Spinal deformities like scoliosis, which can be associated here. Spinal deformities, right? Then, certain limb deformities like club foot, hip dislocation, those things can also be associated, right? And finally, if the uh, time permits, you can assess the child's development as well. Development assessment, if the time permits, right? So those are the basic examination steps you should cover if you are asked to examine a child with meningomyelocele, right? Then once you finish examining and presenting, the examiner might ask what are the investigations you can do here, right? So investigations, you can do a MRI spine to sort of define the defect, right? Then MRI brain can be done to check for any hydrocephalus, right? Then ultrasound scan KUB, renal functions can also be done to check your bladder and kidney functions, right? So those are the initial investigations you can do in a child with meningomyelocele, right? Okay. Now Management. Management. So what are your management steps? So you know here there's a neural tissue which is coming outside of the body, right? So first step is to put a sterile dressing, and prevent infection, which can even lead to sepsis, right? Prevent infection, right? Then what are your management, short-term management options, right? Short-term, you have to put a VP shunt if there's hydrocephalus, right? Then definitive surgery should be done, surgical referral. It is ideal if it's done within 24 to 48 hours. It's ideal, right? Then there are some long-term management steps as well. Long-term management steps. What are your long-term management steps? Right. So one is maintaining good bladder bowel care. Right. That's one of them. Then proper physiotherapy. Proper physiotherapy. Right. Then uh, orthopedic referral if required. Why we mentioned there are some foot deformities and hip deformities which can be associated. Right. So therefore, uh, if required, we can go for orthopedic referral as well. Right. Okay. So basically, that's what you have to do when you get a child with meningomyelocele. Right? Okay. Thank you very much.